Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about Maslow's hierarchy of needs. So what is that and why should I care? What it is a health belief model. And why should you care? Because it's going to help you as a nurse prioritize your patient care, either actually taking care of patients or answering questions on the test. So let's talk about what it is, and then we're going to do some practice Nclex style questions using the model to help us answer them. So let's jump into it. So at the most basic, the bottom is what we need the most to survive, and then it goes up. So basic physiological needs. This includes oxygen status, so airway, breathing, respirations, all that stuff, right? Our fluids, they need to be in balance, our fluid and electrolyte balance. Our heart rate, how's our heart beating? Is it a good rhythm? What's the contractility like? Our nutritional status, are we overnourished, undernourished? What's our nutritional status? Our body temperature, is it within a normal range, or is it dangerously high or dangerously low? Our elimination, so are we eliminating properly? So are we using the restroom properly? No issues with that at a normal time and date and all that stuff? Shelter, do we have shelter? And then even sex. This is our basic physiological needs. So this is our priority. And once these things are met, now we can move on to this one, which is safety and security. So our job as the nurse is to protect the patient from injury. So we're thinking like physical safety, right? Promote a feeling of security. So this is like psychological safety. And then have a trusting relationship with the nurse. Because if they don't have that trusting relationship with you, they're not going to feel safe or secure in the care that they're receiving. So if we've met this, our next priority is to go on to this. If we've met this, then our next priority is to go on to this, and addressing issues dealing with love and a sense of belonging. So some things we can do to assess that is assess the patient's support system. Do they have one? If they don't have one, you become that person, right? This is all about patient advocacy. So making sure they have a support system or becoming that support system for them. And then protecting them from isolation. This could be literal isolation. Maybe they have a communicable disease that's like airborne or something like that, and they're not allowed to be around other people. They're literally isolated. Or, it could just be like social isolation, a mental kind of thing. So protecting them from isolation and making sure they have support systems. They're a part of a group, making sure they can be a part of a group. If this has been met, then we're going to work on their individual self-esteem. Self-esteem comes from competence, so their ability to know what they're doing. This one, it comes into play a lot with like newly diagnosed people who have to learn how to care for themselves at home. So learning a new skill like giving yourself insulin or self-catheterization, something like that. Can they accept themselves in their new condition? And then do they feel worthy? And then once they've reached this level, there's only one thing left, and that is self-actualization. So the highest level deals with the ability for hope and their spiritual well-being. So all of these things are very important. We just need to know what's most important. If your patient comes in and they're saying shortness of breath and chest pain, their self-esteem, not the priority. Is it important at some point? Yeah. In this moment, it's not the priority. It's those basic physiological needs, the oxygenation. So this is Maslow's hierarchy. Now let's use it to answer some Nclex style questions. Now let's use the hierarchy to help us answer some sample questions. Our first one, you're caring for a new diabetic. He is unsure about his ability to follow all the guidelines and wants to just give up. What is the nurse's main goal for this patient? So we can encourage him to ask questions and participate in care, tell him where to buy a glucometer, to have him accept his new condition, or we can explain the pathophysiology of the disease. So think about what's going on with this patient. Okay, this is a mental thing. This is a psychological thing going on with him. He doesn't have the confidence that he needs, right? In his ability to take care of himself once he's discharged. So does that have anything to do with knowing the pathophysiology? No, right? So we can cancel that one out. For him to accept his new condition, that's right here. That's related to self-esteem, right? So that's a contender for a possible answer. B, to tell him where to buy a glucometer. While that is important and he needs to know that, that's not a priority right now. And then A, encouraging him to ask questions and participate in care. That's also really important too, right? Because that's going to help him to feel better about what's going on, and it's going to help him understand the guidelines a little bit better. So this is related to competence. So acceptance and competence, they're in the same part of Maslow's. Which one is the higher priority for this particular patient? Competence. And why is that? Because it's not like he's denying the fact that he has diabetes, right? It's not that he's unaccepting of his new condition. It's that he doesn't understand all the things that go along with it. So he doesn't feel competent in his ability to care for himself. So the answer for this one is A. Let's do another one. Your dementia patient is confused, A and O times 1, so just self. He is yelling for his wife who died 10 years ago to come get him. What is your care priority for this patient? So, are we going to give the patient a sedative? Act as a support system? That's on the hierarchy, right? Love and belonging. Is there anything more important than that? Let's see. Make the patient feel safe. That's more basic, right? Safety and security is more basic than love and belonging. So now it's already, taken our top spot for a potential answer. And then D, teach him how to use the call light. He is not in a position to learn anything at this time, right? So we can just eliminate that answer. So using the hierarchy, we saw B and C. And then what one's the most basic? Safety and security is more important than love and belonging. So we know that C is the correct answer for this patient. Let's just do one more. Okay, one more. Your patient with an eating disorder appears pale and weak upon assessment. What is your main priority of care? A is a positive body image. Yes, we want to encourage that. Where is that on our hierarchy? That's here with self-esteem. All right. Malnutrition. She appears pale and weak, so yeah, that's important. Where is that on our hierarchy? Down here, basic physiological needs. C, refer to a recovery support group. That's good, that's important. That one's up here under love and belonging. And then D, encouraging hope for her future recovery. So that's self-actualization, that's at our top. So our priorities are at the bottom and they work their way up. So which one is our main priority for this patient? B, malnutrition. Are all these other things important and we want to do them? Yeah, of course. We want to encourage a positive body image and get her to a support group and all of that. But at this present time, she is weak, pale, she's very sick. Our priority is her physiological needs. So the malnutrition, that's what we're going to address in this patient. So that was my video on Maslow's hierarchy of needs. I hope you found this helpful. If you have any questions or comments, please let me know. Don't forget to like and subscribe, and I'll see you on the next one.